Good afternoon, everybody. I'm pleased to be here today to announce MASKUP Cook County. First, I'd like to acknowledge those who are standing with me here today. We're going to begin with Michael Albert and David Jones, who are sign language interpreters. Dr. Rachel Rubin, who's a senior medical officer at Cook County Department of Public Health. Dr. Kiran Joshi, who's senior medical officer at Cook County Department of Public Health. Vanessa Melgoza, who's Director of Health Services at Corazon Community Services in Cicero. Danielle Maya Banks, who's a journalist and a storyteller, and Jaleel Anthony. Since the first case of COVID-19 was confirmed in Cook County at the end of January, we've been responding and reacting to the impacts of a national pandemic. This has been a challenging year for everybody. While we've made tremendous progress in slowing the spread of this dangerous virus in the last few months, the challenge isn't over. While any single life lost is too many, we're encouraged by the fact that the number of deaths reported each day has steadily declined. I would point out, however, that we've lost 180,000 people in our country in the course of this pandemic. These trends in rising cases but lower death tolls can be attributed to the fact that Cook County has seen the biggest growth in the 20 to 29-year-old age group between last March and July. In fact, during this period, we saw a 250% increase in cases as young people return to their social gatherings and travels and have often been lax in mask wearing. Our young people must understand that they are not immune to the virus. And even if they are asymptomatic or experience mild symptoms, they can still spread the virus to others who are elderly, like their grandparents, immunocompromised, or otherwise at high risk. That's why this campaign is so important. Young adults must continue to be vigilant in wearing masks and not partaking in high-risk or large group activities. We hope that MASKUP Cook County will appeal to young adults' sense of social justice and social responsibility. As a strong supporter of peaceful protests, I was proud of the thousands of young people who've responded to injustices and violence. MASKUP Cook County is a largely social media campaign because we know that that is one of the best ways to reach our young audience. Digital ads will run through suburban Cook County on YouTube, Instagram, and Spotify throughout the month of September in both English and Spanish. Ads can be delivered in heavier concentration to areas of concern if clusters or outbreaks pop up, for example. I know that our younger generation has the potential and the will to change the world. I hope that MASKUP Cook County will reach them and that they will do their part to keep our communities safe. Now I'd like to call on Drs. Rubin and Joshi to the podium to talk about the Department of Public Health's role in our campaign. I'll start with Dr. Rubin.
Thank you, Madam President, and good afternoon, everybody.
Good afternoon.
So this past Friday, we shared that in suburban Cook County, we have seen an increase in 2 of the 8 metrics the state is monitoring to ensure the public is not increasing in their risks for COVID. We continue to see a rise in the rate of new cases diagnosed each day, and the rate of deaths has begun to increase again. So those are the 2 metrics that we have now seen a change in. Our region, which is Region 10 on the state metric map, turned orange as a warning that the risk for getting COVID in suburban Cook County is increasing. We cannot let up, especially now, as some schools have returned to in-person learning. Even before schools have started, we began to see more cases in grammar and high school-aged youth. This is very concerning. We are prioritizing investigations of clusters in this age group for now, as well as young adults in their 20s. In August, we have been providing guidance to schools through a series of school health webinars and responding to numerous queries from school officials and school nurses. We are in the process of expanding our contact tracing team to about 400 staff throughout the fall, And as we do, we are keeping a watchful eye on the situation and asking everybody, not just young people, to mask up so we don't have to close up. Right. Also, maintain a physical distance of at least 6 feet even when outside, and wash your hands frequently. And so here to tell you a little bit more about the MASKUP campaign is my co-lead at the Cook County Department of Public Health, Dr. Kiran Joshi.
Thank you, Dr. Rubin. Good afternoon, all.
Good afternoon.
There is no doubt that 2020 has been a rough year, and not just because of COVID-19. We are tired, and I know we just want it to be over. We want to spend time with our families, our friends, our coworkers, neighbors, all of our loved ones, our community. We too are exhausted. Our team at the Cook County Department of Public Health has been working nonstop since our first case on January 24th. The reopening of Illinois after the first surge of cases was a welcome relief for all of us, including residents and businesses of Cook County. I hate to be the bearer of bad tidings, but we are now in the beginning stages of a second surge. And some schools are open. Cooler weather and flu season are coming. Now is not the time to take our foot off the gas. We are planning campaigns to talk about the importance of getting a flu vaccine and answering your phones when our contact tracers call. Pardon me. But for now, it is the time to mask up Cook County. We are calling on the next generation of young adults to wear it, don't spread it, mask up and back up, to protect yourselves, your families, and your communities. I'm very, very excited that here today with us are a few of the young people representing some of the communities most impacted by COVID-19 in the south and west suburbs. First, it is my pleasure to introduce Danielle Maya Banks. Danielle is 25 years old. She's a journalist, a creative writer, and wellness advocate, intent on using advocacy and education to guide us through this unprecedented moment. Thank you.
Thank you, Dr. Joshi. Hi, all. My name is Danielle Maya Banks, and I'm honored to be here today representing the South-Southwest Comprehensive Strategic Partnership, led by Hazelcrest Mayor Alsbury and spurred in response to protect our Southland communities from COVID-19. We are joined by over 60 other organizations, including the Cook County Department of Public Health, healthcare systems, community and faith organizations, school districts, community colleges and universities, as well as business and commerce entities in our efforts to dispel myths, provide testing, and save lives here in the Southland. As Governor Pritzker commented last month, it is Illinoisans aged 20 to 29, my generation, that represent the largest demographic of COVID cases. Experts are concerned for our health and the health of our families. They stand frustrated by our poor decision-making. Still, this has been an unprecedented year, with more losses than we can count. From Kobe to Chadwick Boseman, Jacob Blake, Breonna Taylor, George Floyd, and so many others. And atop it all, this pandemic has creeped into our lives unannounced. It has stolen our cherished loved ones like a thief in the night. For us, millennials and Generation Z, it is our social bonds, especially those forged offline, that carry us through times of heartache, but also of celebration. It is the wine nights that we enjoy after a tough breakup or a brutal day at work. It is the all-out ragers that we earn after 4 years of undergraduate study. We turn to each other to mark the spot, to name the important moments in our personal histories, birthdays, graduations, the deaths of our heroes. I get it. But the time is now to focus on just that, history. When we look back on this fiery time, on which side will we, the young leaders, stand? Will we excuse our decisions to carry this novel and unpredictable virus into the homes of our of our parents, our grandparents, our loved ones? No, I know that we are a generation of inspired and imaginative young leaders, that we are most loyal to our families. And so, my message here today is to remind us all of that. Indeed, let us make decisions today that will create a legacy in which we will feel pride for a lifetime, pride that we wore the mask, pride that we watched our distance, pride that we took all of the tiny, impactful measures that we know can save lives, like washing our hands for 20 seconds and taking a free COVID test as often as we can. Because we are not selfish or short-sighted. No, we are lovers of family, of community, of essential workers risking so much for us every single day. This is why our MASKUP campaign is so important to millennials and Generation Z, because we are the heart center of American culture, the budding leaders of local politics, and the architects of a brighter tomorrow. Let's do our part. It is this obligation that has driven me to join the Community Service and Engagement Subcommittee of our larger South-Southwest partnership. Allow me to invite you all to our virtual town hall, Behind the Mask, via Zoom this Thursday, September 3rd at 7 p.m. as youth advocate Jaleel Anthony and myself, with a panel of young leaders, discuss millennials' take on COVID-19, Black Lives Matter, and where they intersect. Because as Drake so poignantly put it, it's been a really long fight. But friends, we must not tire until it's won. So wear a mask, wash your hands, watch your distance, and join us this Thursday on Zoom to unpack it all. Next, I'd like to introduce Ms. Vanessa Melgoza. Ms. Melgoza, at 24, is the Director of Health Programs at Corazon Community Services, a nonprofit organization located in Cicero, promoting the importance of health and well-being within our communities. Thank you.
Hi, thank you, Danielle and Jaleel. I am happy to be here with you today. The Mask Up Cook County campaign is important because it demonstrates communities working together for a common goal. Unfortunately, many communities do not have access to the same health equity. This campaign will empower communities to keep each other safe and encourage others to do the same. This campaign will help motivate young adults maintain health awareness. Many young adults feel they are invisible, and they do not take viruses such as COVID-19 seriously. This campaign will help keep our young Latino communities educated about the importance of wearing a mask and the consequences of not wearing it properly. Additionally, this will improve early intervention before new COVID-19 cases spread. The benefits of this campaign being both in English and Spanish is pivotal for the Latino community. This conveys the importance of reaching out to everyone. Especially language barriers, have been a significant factor for individuals not being able to communicate properly. In many Latino communities, many youths serve as translators for their nonprofit English-speaking family members. This is a major issue because many messages get lost in translation. Furthermore, it is important that all families receive the correct messages and that they have the same opportunities where the language is not a barrier to survive this pandemic. Cook County Department of Public Health has a Spanish COVID-19 website, and the Mask Up Cook County website will soon be available in Spanish as well. Go to cookcountypublichealth.org and click on COVID en Español. Esta campaña es importante porque demostrará la importancia de que las comunidades trabajen juntas por un objetivo común. Desafortunadamente, muchas comunidades no tienen acceso a la misma equidad en salud. Esta campaña empoderará a las comunidades para que se mantengan seguras entre sí y alentará a otros a hacer lo mismo. Esta campaña ayudaría a motivar a los adultos jóvenes a mantener la conciencia sobre la salud. Muchos adultos jóvenes se sienten invencibles y no están tomando en serio los virus como tal el COVID-19. Esta campaña ayudará a mantener a nuestra comunidad latina joven informada sobre la importancia de usar cubrebocas y las consecuencias de no usarlas correctamente. Además, esto mejorará la intervención temprana antes de que se propaguen nuevos casos del COVID-19. Los beneficios de que la campaña sea tanto en inglés como en español es fundamental para la comunidad latina. Esto transmite la importancia de llegar a todos, Especialmente las barreras del idioma han sido un factor importante para que las personas no puedan comunicarse correctamente. En muchas comunidades latinas, muchos jóvenes sirven como traductores para sus familiares que no hablan inglés. Este es un problema importante porque muchos mensajes se pierden en la traducción. Además, es importante que todas las familias reciban el mensaje correcto y que tengan las mismas oportunidades, donde el idioma no sea una barrera para sobrevivir a esta pandemia. Gracias.
All right, thank you. Thank you all. I think
We have questions on the line.
questions on the line.
Rachel Hinton?
Rachel Hinton?
Hello?
Yes, Rachel.
Hi. I guess, at what point will the county maybe begin scaling back business operations more than what they previously did earlier this month?
All right. Dr. Rubin, guidance for businesses. At what point will guidance change for businesses in terms of the severity of the pandemic?
Yeah, thanks for that question. At the moment, we are not changing our guidance. What we want is the guidance that we put in place on August 3rd to be adhered to in terms of no indoor bar service and decrease the number of patrons at tables in restaurants, to keep the capacity in commercial businesses to 50% or less. So these are the kinds of things that we want to be adhered to. If our metrics continue to worsen, such as we continue to see a continual rise in cases and our positivity rate, if we continue to see increasing deaths and that death rate happening, then over the next several weeks, we may indeed be asked by the state of Illinois to put in place more strict guidance that might actually have some level of enforcement behind it as well. And also to remind people that there was a recent state order that says that it strengthens the masking, and it's quite consistent with this MASKUP campaign, which is that even in restaurants where you're going in to eat, please keep your masks on until your food arrives, and after you're done with your meal and you're still socializing with your party, please put that mask back on. Also, anytime a server approaches your table, please put that mask on so that server will not be exposed to your breath within their breathing zone. So I can't give you an exact date, but we are watching this, and we imagine the state may push us to put more guidance in place, potentially enforceable over the next several weeks.
Thanks. And just a question for clarification. Dr. Joshi said that we're in the beginnings of a second surge. Did you mean just suburban Cook County, the state, nationally? What did you mean by that?
All right, did you hear the question?
Yes. Yeah, I think we're seeing the pandemic play out at different rates in different geographical areas. My comments were specific to suburban Cook County, and I think they are, though, generalizable to the region. We're seeing a pretty significant increase in cases, and we have been for the last month or so. We're fortunate, I think, at this point in that we're not seeing a concomitant increase in hospitalizations. The reason for that is that the age breakdown of the cases that we're seeing is much younger than what we saw back in April and May. And while that's a good thing, I think the underlying message here is that young folks, while they may not get as sick, they can sort of continue that cycle of transmission and certainly transmit COVID-19 to vulnerable folks like folks with chronic conditions and our seniors. And what we're trying to do is really to protect those folks. It's all towards the end of protecting our most vulnerable residents. Thank you.
Thanks. I have one off-topic question, so could you come back to me?
Yeah.
Sure. All right.
Steve from
Thank you.
WBBM.
Steve from WBBM?
Yes, I I'm just curious. There have been so many deaths. What, 5,000 deaths in the county so far from COVID? Why, if that's not enough to convince people, even young people who may not die as much but certainly get sick and spread it, if that's not enough to convince them to wear masks, why do you think this campaign will work?
All right, so the question is, 5,000 people have died in Cook County. Why aren't people being more cautious? Let's have our young people respond. How's that? Oh, good, Jaleel, I like it.
I would personally say a lot of the people that we've seen asking for us to do this have not been young people. And the narrative that was originally pushed that young people weren't affected by it at all. And there was miscommunication, I would say, from us. And so now that there's young people on the front lines, there's young people pushing this campaign and advocacies and social influencers, I think now we have an opportunity to get ahead of this before it gets even worse.
Hey, Jaleel, can you spell your first and last name for everyone else?
My first name is Jaleel, that's Jaleel, and last name Anthony, Anthony.
And how old are you?
And I'm 19 years old, from the Proviso Township.
Thank you, Jaleel. All right, that's Steve. Do you have any further questions, Steve?
No, thanks.
All right,
Is there anyone else on the line?
Rachel and Steve.
This is Alice. This is Steven.
Alice, okay.
I was just wondering, can you clarify the difference between a surge and a wave? Because I remember reading that other experts were saying we're still in the first wave.
A surge and a wave, Dr. Joshi. Good luck.
Just to keep things simple, I think it's fine to use those terms interchangeably. Thank you.
Okay, thanks.
All right, so that was Alice. So Rachel, Steve, and Alice. Is there anybody else on the line? All right, hearing none. Rachel, your off-topic question.
President Trump is, slated to go to Kenosha tomorrow. Do you think he should go? Do you think he should cancel this trip?
Well, clearly, I think there's a very volatile situation there, and I don't see how the president's presence contributes to peace and harmony, especially since he's been quite outspoken in his respect and affection for white supremacists. So I think it's a terrible idea, but I have no influence on the president's decision-making.